So obesity, like, is a complex disease.
Yes.
It's more of a complex interplay between so many factors. So we have factors like genetic factors to contribute, environmental factors, psychological factors, socioeconomic risk factors, and also lifestyle. Lifestyle contributes a significant amount to obesity. In addition to that, lack of physical activity, unhealthy lifestyle,
Hmm.
sedentary lifestyle, being in an obesogenic environment too. So the complex interplay of all these factors can lead to promote positive energy balance and eventually obesity.
Yeah, that's interesting. Especially you said the psychiatric or psychological risk factors.
Yes.
What do you tell patients? I'm sure you heard this before. Doc, I've been obese all my life. Like this how God made me.
I get that every now and then. Yeah. So I'm always very empathic to patients that always come with that always feel hopeless. And I start by telling them obesity is a chronic disease, first of all. So you have patients who have hypertension, who have diabetes. That's chronic. So obesity is a chronic disease, is a disease. And then secondly, I make them understand that this is a complex disease.
Mm,
So, because I've
mm,
had patients who tell me, oh, I exercise, I'm
mm,
eating right, but
mm,
I don't
mm,
seem to lose weight. So I also make them understand that this is not necessarily, yes, lifestyle has an important factor, but there could be other factors. There are some people that could inherit genes from their family, like the inherited genetic factors that will predispose them to obesity. So I
absolutely.
just reassure them that it's a complex interplay,
Mhm.
not just one specific cause of can lead to obesity.
Yeah, that's great. And then also, I'm glad you call it a disease. Obviously, you're studying to manage it. So, of course, it's a disease. However, though, the community, there's still some stigma around it. Is that the case still? Do you think there's still a stigma around obesity?
I feel that has improved significantly in the last couple of years.
Okay.
Trying to navigate away from stigma to actually accepting the fact that it's disease. Is a stigma there? Yes, but I would say it has improved significantly. People are now beginning to realize, okay, yes, even if I'm on the, I have obesity, not I have obesity. This might not just be stigma; it might be is a disease and
Hmm.
all that. So in the last couple of years, I would say the stigma is getting better.
Hmm.
People are now becoming aware that this is more just not just this is more than just being a stigma.
Right. It's more than just I'm eating too much. It's more than all you got
Exactly.
to do is stop eating. It's more than that.
Exactly.
Yeah, I feel
Yeah.
that. I feel that. Now let's talk about some lifestyle changes that can be made. More specifically, alcohol. How does alcohol affects obesity?
Yeah, studies have shown that there's an increased risk of obesity with for frequent alcohol users. Yes, so obesity, alcohol has several interplays in the sense that it can also trigger inflammation.
Mm,
Excess alcohol can trigger inflammation, which is also one of the pathophysiology of obesity. So, in other words, excess alcohol can lead to obesity by indirect mechanism, which like inflammatory reactions too.
absolutely. Now, is that the same pathophysiology as stress? As one who's holding and carrying a lot of stress on their shoulders every day, that patient that's probably working two jobs, taking care of a family,
Yes.
obviously can't work out, probably, but also a component of stress. How does stress affect obesity?
So naturally, like I said earlier, we talked about like some of the risk factors, including psychological risk factors. Yes, so stress is, in fact, talking about that, I had a patient earlier on that we also addressed this because stress can lead to obesity because during very high stress levels, the body responds by increasing cortisol.
Hmm.
Cortisol is a stress hormone, and that will significantly lead to dynamic changes in the body and inadvertently lead to obesity. So stress can lead to significant amounts of cortisol levels. Yeah.
Absolutely. And, I'm a physician that prescribes steroids sometimes, for bad
Yeah.
reactions. And, I see patients, I've prescribed those steroids and they get puffy and, they
Yeah.
start getting a little weight. And the reason why I'm saying this is because cortisol is very similar to prednisone, just for our listeners to understand. I know I'm not telling you anything novel, but, for our listeners,
Yeah.
cortisol and prednisone, or steroids are very similar. It's just the cortisol is your own natural way of
Yes. Yeah.
secreting those same steroids, and so same similar effects. Obesity.